All right, grade 11s, thanks for joining me for lesson 6 on blood coagulation. In this lesson, we'll be talking about how the body prevents blood loss when a vessel is damaged, what happens when the body is unable to form blood clots effectively, and then what happens when our bodies form too many clots. So when a blood vessel is damaged, the body responds to the loss of blood. Your bone marrow has worked hard to produce red blood vessels, and we need red blood cells. And your tissues need red blood cells in order to get oxygen. So when there is a breach or a rupture in your vessel, your body's going to work hard to stop that loss of blood. And this stopping of the loss of blood is a process called hemostasis. We've got hemorrhage, which is the opposite of hemostasis, and hemorrhage is the escape of blood from a ruptured vessel. Blood contains many proteins called clotting factors that are going to stop bleeding. So hemostasis has 3 stages. We have vasoconstriction, we've got the formation of a platelet plug, and we've also got coagulation, which is also known as blood clotting. We've got this diagram down here, kind of shows the 3 steps. Step 1 being the vasoconstriction, 2 being the platelet aggregation or formation of a plug, and then we've got the clot forming down here. Okay, so vasoconstriction is the constriction or narrowing of the vessel. So there is a rupture and the smooth muscles within the vessels are going to constrict, and that's going to decrease blood flow to the affected site. This whole process is to stop the loss of blood. So if you can kind of decrease the amount of blood that's reaching that site, that is a good thing. So with less blood flowing to the site of injury, essentially less blood is lost. Next, we have the formation of a platelet plug. So within 20 seconds of a vessel being ruptured, platelets are activated. So they're activated when the inner lining of your vessel is broken, and it's going to release a molecule called collagen. So the platelets kind of sense the collagen and then they become activated. So they're going to bind to the site of where the vessel has ruptured. And then they're also going to stick to other platelets, and it's going to cause this chain reaction of platelets gathering at this site. And when they clump together, it's called aggregation. And so when a bunch of platelets join at the site of the broken vessel, it's going to form a plug. And in a very small rupture, this platelet plug can be enough to stop hemorrhaging. But when it's not, we've got to go one step further, and it's going to form, it's going to go into coagulation, and a blood clot is going to form. So if it's not able to be stopped by only a platelet plug, blood clot begins to form. So if you remember back from last lesson, we had the 2 proteins found in our plasma. There was one called prothrombin and fibrinogen. These 2 are involved in the blood clotting process. So there's a chain reaction between these 2, and essentially fibrinogen gets converted into this protein called fibrin. And so fibrin essentially begins to weave around the platelet plug, trapping platelets in blood cells and just kind of really stopping that loss of blood. It's going to seal the rupture of the vessel. So I guess if you've ever had a cut on your hand or your arm, you notice a scab starts to form after bleeding has stopped. So that's kind of the cap on the ruptured vessel. And it can also be, that's also going to happen when you have a bruise. Your bruise isn't continuously spread from the site of impact. It slows down and it stops. So after the healing process, it happens, an enzyme called plasmin is going to dissolve the scab or the bruise and kind of take that away. Okay, so when your body is unable to control clotting, it can have 2 outcomes. So one, your body doesn't have the ability to clot very well, and it's going to result in excessive bleeding. And then you can have the other side of the outcome where your body may have excessive clotting, so it kind of forms clots unnecessarily, and those can be really harmful to your body as well. So uncontrolled bleeding, hemophilia. It's a genetic disorder caused by defective clotting factors. A person with hemophilia, they bleed longer than those without it, and bleeding can occur internally, and it can affect joints and muscles. The defective gene responsible for causing hemophilia is found in the X chromosome. So it is a sex inherited or sex linked trait. And most cases of hemophilia are passed from a carrier mother to her son. So a woman don't often have hemophilia, but it's not impossible. Kind of an odd stat, roughly 30% of cases are not actually inherited and they're caused by a spontaneous mutation. So these people, nobody in their family that they really know of have hemophilia. It's just caused by this mutation. So uncontrolled clotting, opposite of uncontrolled bleeding. A blood clot or thrombus can travel and cause massive tissue damage to the organs. Increased clotting can be caused by the anti-clotting protein hairpin malfunctioning. So hairpin's present just to prevent these unnecessary clots. It's always kind of around and monitoring that. When you have a blood clot that is traveling throughout your body, it's called thrombosis. So a pulmonary embolism is a thrombus that becomes stuck in your lungs. So if you look at this diagram here, it's a little bit exaggerated, of course, but we see we've got red blood cells moving here. We have a clot. We've got those little spiny objects there are platelets, and this fiber is that fibrin. So essentially what's going to happen is it's going to block a vessel, and these red blood cells aren't able to travel through and deliver oxygen to the tissues on this side. So that happens in your lungs. Your lungs are such a necessary and essential part of your everyday life that if you weren't having oxygen going to the tissues of your lungs, you'd be in trouble because it would start to damage the tissues. Stroke is a thrombus that causes a blockage in the brain. We'll talk a little bit about stroke near the end of the lesson. And you may have seen this in your research when you were looking up heart attacks, but coronary thrombosis is a blockage of a coronary artery, which causes a heart attack. So if this was happening in your coronary artery, you're not getting that blood supply to your heart tissue, which is going to die fast without oxygen. Okay, so a couple of risk factors that can increase your chances of having of thrombosis. So prolonged bed rest. So if you underwent surgery or you're in the hospital for a long time and your body's just not really moving, it can increase your risk of a blood clot. Kind of similar situation being seated too long and airplane rides. Tobacco use can increase your chances of having blood clots. A big one is birth control or hormone replacement therapy. Often with these medications, there's kind of a warning enclosed that if you're over the age of 35 and you use tobacco, this product isn't for you because the risk of having a blood clot is greatly increased and might not be essentially worth it. Having cancer can increase your chances of blood clots, and as well as family history of dangerous blood clots. So someone in your family has been affected by a dangerous blood clot, it's maybe in your genes that you're more prone to this condition. So a stroke is a loss of blood flow to areas of the brain. And the effects of the stroke can be different kind of depending on where the stroke occurred. If it happened on the left or the right side of your brain, they both have such different responsibilities that it can kind of greatly vary on where it happened in your brain. The type of stroke, so if it's ischemic or hemorrhagic, we'll talk about the types of stroke momentarily. A big one is the amount of time the blockage prevented blood flow to the area. So when it comes to if someone is having a stroke, the biggest thing is to act fast and to get medical attention to that person as soon as possible, because when left untreated, the effects of a stroke can be greatly exacerbated or made worse if it's left. Because damaged cells from a moderate to severe stroke cannot be replaced or repaired. There's something called a TIA, which we'll go into shortly, which is a very minor or almost a warning stroke. So that won't cause irreversible damage, but as the blockage remains and tissues are left without oxygen, the effects can become irreversible. So a stroke can cause paralysis on both or one side of the body. So it kind of depends on what side of the brain was affected, but it can, if it is I'm trying to think, this would be the left side. If it's the left side of your brain, it's going to affect the right side of your body. And if it's the right side of your brain, it's going to affect the left side of your body. Um, Troubles forming speech. One of the main symptoms of someone having a stroke is they have kind of slurred or they have trouble talking. And then it can cause kind of damage with them thinking, memory, and attention. So there's three types of strokes. Ischemic stroke and the transient ischemic attack are quite similar or cause kind of the same thing. So an ischemic stroke is the most common, and it's when a blockage forms when plaque accumulates inside a blood vessel in the brain, and then a blood clot is kind of thrown into the equation. So the clot can form in the brain or it can form somewhere else in the body and then travel to the brain. But essentially it reaches the site where the vessel is clogged, and then it's going to cause that blockage and that loss of blood to the brain tissue. We've got our hemorrhagic stroke, which occurs when a vessel within the brain bursts, causing hemorrhaging. So that's this diagram on the left here. High blood pressure or hypertension can weaken vessels over time. So what ends up happening is the vessel gets weaker, and an aneurysm, or that ballooning of into the vessel wall, can occur, and then the vessel bursts. So that's a hemorrhagic stroke. And then there's a transient ischemic attack, or a TIA. It's a small clot that briefly blocks a vessel in the brain. So a TIA doesn't always cause permanent tissue damage. It's sometimes called a warning or a small stroke. But it can often kind of lead to a ischemic stroke or a little more serious stroke. So even when you're experiencing these symptoms, you want to act fast because it could turn serious very fast. So signs of a stroke. When someone's experiencing symptoms of a stroke, 911 should be called immediately. So there's this acronym FAST. Is the face drooping? So stroke can kind of affect your muscles. Often people will lose control of one side of their face depending on where the stroke had occurred. Strokes affect your ability to move your shoulders. So if you're unable to raise your arms, you might be having a stroke. Person who's experiencing a stroke kind of have this slurred or jumbled speech, and it's time to call 911 right away. So time is crucial. The longer that blockage is preventing blood flow to the brain, or the longer that hemorrhage is happening, the more irreversible effects of a stroke could stay with that person for the rest of their lives. So that's the end of the lesson. A couple of questions for your assignment. What are the three stages of hemostasis? Hemostasis. So talking about the vessels kind of constricting and stopping the flow to the site of the rupture. We have our platelet plug, and then we've got the next step, which is blood coagulation, and that's when the fibrin is going to kind of grab all the red blood vessels and the platelets and keep this chain reaction going to prevent loss of blood. Kind of answer that question there. How is a blood clot formed? So just kind of talking about how fibrin is involved and how that stops the bleeding. What is hemophilia and how is it caused? So hemophilia being a disorder where clotting factors are not working as efficiently with the person, and they are more prone to bleeding. You can't just catch hemophilia. It's usually genetically inherited or caused by a gene mutation. What are the three types of strokes? We've got our ischemic stroke, the hemorrhagic stroke, and then we've got the TIA. And just kind of talking about what are the differences between those and what causes them. And then there's a multiple choice question that is, what should you do if someone is showing signs of a stroke? So it's important to be aware of that. I'll go back to the last slide. I've seen buses in Winnipeg that have the same acronym. So it's just good you could save somebody's life if you're able to recognize those signs. So that is all for today. You can do demand 5.6 if you'd like. You can also, if you're into taking notes throughout the lesson and you want to submit those instead, I'm very happy to take those as a form of assessment. So hope you enjoyed today's lesson. Stay tuned for lesson 7, which is on blood types.